Hello, I am Dr. Sanjay Kumar Rai, Registrar in Medicine, Khulna Medical College Hospital. Today, I would like to talk on a very simple topic, that is mast cell. Mast cell, very easy. Mast cell. Mast cells are present in the tissue. They originate in the hematopoietic stem cell in the bone marrow. From bone marrow, they enter into the blood in the immature form, and then they enter in the tissue and reside there for lifelong as the mature form. But the problem is basophil. Sometimes we think that mast cell and basophil are same type of cell, and sometimes we also think that basophil is the blood form and mast cell is the tissue form of same cell, but that is not correct. Mast cell and basophil, of course, a different type of cell. They have different type of precursor. That is, mast cell and basophil are originated from different hematopoietic lineage, but they have similarity in function. Okay, but they are dissimilar in development, and they are also dissimilar in appearance. What is that? Mast cell has a large nucleus which is not lobulated. On the other hand, the basophil has multilobulated nucleus like this. So this is the difference, mast cell and basophil, developmental difference and appearance difference. Another difference is basophil present in the blood. Okay, B for blood, and mast cell present in the tissue. So these are the differentiating point between mast cell and basophil, but there is functional similarity they have, and I would like to talk on that point now. Mast cell is two type. Mast cell is two type. Number one, mast cell T, that is mast cell containing tryptase, and mast cell TC, that is mast cell containing tryptase plus C. C means chymase, and carboxypeptidase. So these two type of mast cell. Why should we know about this very critical type? That's because the mast cell T type, that is mast cell containing tryptase, are present in the mucosa of respiratory tract and GI tract, and mast cell containing T and C, they are present in the submucosa and connective tissue of skin. Okay, so if any pathological problem relating to mast site occur in the respiratory tract or GI tract, then tryptase will take part in the pathogenesis. And when there is any problem in the submucosa or connective tissue of the skin, that is skin disease relating to mast cell problem, then tryptase, kinase and carboxypeptidase will take part. Actually, this tryptase, kinase and carboxypeptidase are serine protease. They are serine protease. They are responsible for breakdown of tissue protein. Okay. Now I will talk the process of mast cell degranulation. Okay, process of mast cell degranulation. Mast cell degranulation is two types. Number one, IgE mediated mast cell degranulation, and number two, non-IgE mediated degranulation. The IgE mediated mast cell degranulation is called anaphylaxis, and this is also called type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction, IgE mediated mast cell degranulation. This is called type 1 hypersensitivity reaction. On the other hand, the non-IgE mediated mast cell degranulation, there are some process where mast cell as well as basophil degranulation occurs, not involving immunoglobulin E. That process is called anaphylactoid reaction. Anaphylactoid reaction. Okay. Now we will see what are the process where the mast cell degranulation occurs without involving immunoglobulin E. Who are they? Very important one is complement component. Complement component. Who are they? C3A and C5A. These are called anaphylatoxin, the protein or molecule in the complement activation process. These complement component can directly stimulate or activate the mast cell for its degranulation. Others like drugs like opioid, NSAIDs and ACE inhibitor, very important, ACE inhibitor. And sometimes mast cell degranulation occurs in autoimmune disease like SLE, rheumatoid arthritis. Okay, so these are the process of degranulation of mast cell. Now I'd like to talk on very shortly the IgE mediated mast cell degranulation. IgE mediated mast cell degranulation occurs at first an antigen enter into the body of our body, and that antigen like this will be engulfed and processed by the dendritic cell or macrophage, that is antigen presenting cell. This is antigen presenting cell, and these antigen presenting cell will present this process antigen to the T cell, that is helper T cell. These helper T cell then activate the B cell. The activated B cell will be differentiated into plasma cell. Okay, and the plasma cell then produce the specific immunoglobulin E. This immunoglobulin E will be very specific to that antigen only. Now the antigen E, the receptor for antigen E is present only and only in the mast cell and basophil. So this is mast cell or basophil, and its surface, cell surface, contain the receptor for IgE. So this produced IgE will be attached here like this. So this is the first attack. Now in second and subsequent attack, if occur, the antigen come here and bind with this specific immunoglobulin E, which is already attached to the mast cell, and the cross linking between the adjacent two or more IgE activate the mast cell and causes the degranulation of its content. So this is the short way of description on how degranulation of mast cell occur. Okay, so this is the short discussion, and I will finish this lecture on the clinical importance of this mast cell. Clinical PAL. Clinical PALs. What are the importance of knowing the mast cell? Okay. Number one, the mast cell problem occurs in parasitic infection. Parasitic infection, like helminthiasis and protozoal infection. As I said, the mast cell T type which are present in the mucosa of respiratory tract and GI tract. So GI tract infection with helminth or protozoa will stimulate the mast cell, leading to itching caused by histamine release. So parasitic infection, in case of parasitic infection, mast cell degranulation will occur and it will manifest its clinical manifestation. Okay, now the number one. Number two, most important, allergic disease. Allergic disease, as we know, there are so many diseases are related with the mast cell degranulation. The number one, the asthma, that is bronchial asthma. Then urticaria. Then angioedema. Then atopic dermatitis. Then allergic rhinitis. Then conjunctivitis, allergic conjunctivitis, of course. So these are the allergic disease which are related to the abnormal degranulation of mast cell. Then another important disease, mastocytosis. 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 Mastocytosis, mastocyte or mast cell, also called mastocyte. Mind it, mast cell also known as mastocyte. So mastocytosis means, the name suggests, cytosis of mast. That means a huge number of mast cell present in the body due to clonal proliferation. Clonal proliferation. It is a neoplastic condition, and as the huge number of mast cell there, so huge amount of degranulation product of mast cell will manifest systemic manifestation. So mastocytosis may occur. Now another neoplastic, mast cell neoplastic condition, others like mastocytoma. Mastocytoma. Then mast cell sarcoma. Mast cell sarcoma. Then mast cell leukemia. Okay. Another important one is mast cell activation syndrome. Mast cell activation syndrome. Okay. So 1, 2, 3, 4, 5. These are the 5 clinical importance disease entity of mast cell. So we have enough scope to study here. If you want, you may go through the each disease. So this is the ending of this video. Next video will be on the urticaria, I hope. Thank you very much.